committee, and we practice relationship-based care.
Relationship-based care is about the relationship I have with myself.
Relationship-based care is about the relationship I have with my colleagues.
Relationship-based care is about the relationship I have with my patients.
Here in the CCU, we use resource-driven care to help reinforce a relationship-based practice. Those are seen in different things, such as utilizing our other nurses, our certified breastfeeding counselors, respiratory therapy, our nurse leadership roles with our managers and their director, and any other resources that we have with child life or even case managers and social work.
One of the components of relationship-based care is leadership. Nurses demonstrate this by sharing what we learn from our own experience and bringing our feedback to our leadership so that they can continue to improve the care we provide to our patients.
Nurses also show this by precepting other nurses. We empower them to become leaders themselves, and we also help them reach their full potential.
In August of this year, I will be attending Rush University to get my DNP in pediatric nursing. Lurie Children's supports this by encouraging us to go back to school and enhance our degrees and gives us tuition reimbursement.
Our leaders promote resource-driven practice by giving us time off the unit to review and revise our IPOCs, to meet as a committee, and to do chart audits to figure out what we need to work on as a team.
We practice relationship-based care.
One of the concepts of relation-based care is patient care delivery, and we involve the patient and family in the center of care.
And one way that we provide this is when we start our day, we enter that room and introduce ourselves to the families. We try to make the families feel it's the optimal level of care, but we try to promote that with the families when we introduce ourselves, trying to make them feel comfortable with us. We're trying to build that relationship. Let me find out what I can do to make your stay, your experience here with us, one of the best.
One aspect of relationship-based care is a caring and healing environment. Here in the NICU, we provide that in several different ways. A few ways that we provide that is simulating a room-like environment for each patient. So we keep the doors closed at all times when possible. We have double blinds and private rooms for each patient. Another aspect of a caring and healing environment for the parents is pumps in the rooms, and the Jackson Chase Foundation provides daily parking passes for each parent so that they can be bedside and provide skin-to-skin care.
And one of the things we look at is how our outcomes are affected by this. One thing we have been able to start is donor-based breast milk.
Donor breast milk has decreased the length of hospital stay for our babies, decreased the incidence of NEPs,
the opportunity to get our kids discharged early.
We always work closely with our attendings. They're always right next to us. If we have any questions, concerns, they're always right there to assess patients, but they also ask our opinion on a lot of the patient's care too.
Another example of teamwork is like when we work with other interdisciplinary co-workers like the EPS and keeping our units clean, respiratory therapists with our patients, and we also come up with different projects together with them.
Teamwork is a part of relationship-based care in the PICU. Every day we work with PT, OT, RDocs, extra nurses, nursing assistants, the chaplain, social work, and we all work together to make the PICU a better place.
So one of the components of relationship-based care for us on the transport team is teamwork, which is an incredibly important part of what we do as we're out there transporting critically ill children and babies. Our ability to rely on each other and work well together as a team is critical to what we do in getting these children back here safely.
Yeah, one of the things I value most in all the years that we have worked together is our compatibility and our good communication.
I practice. We practice relationship-based care.